What's going on, everyone? Welcome back to the Happier, Healthier Arkansas podcast. I'm your host, Dr. Cameron Daniels. Today, I not just have a really special guest, but I have a very, very special friend. With me, I have Mitzi Love. She's a master massage therapist. And what's interesting about her is that her particular specialty, it's not just in muscles. We talk a lot about that with massage therapy, right? It's not just in muscles. It's not just in relaxing the muscles and getting people to feel good. Her particular specialty is she does a deep dive into lymphedema and exactly the consequences of creating sustainability inside your lymphatic system. So without a pleasure, Mitzi, thank you so much for being on. Thank you so much for being on.
Thanks for having me, Cam.
So I always like to start off the podcast with this question when I'm interviewing someone, and it's this simple. How do you make Arkansas happier and healthier?
Well, I like that I get to say that I get to do that. And I do it through, first of all, really genuinely caring about my clients. Absolutely genuinely caring about them. Serving them in the field of lymphatic therapy. And I address that many different ways. From post-plastic surgery to just complete, get you out of fight and flight into rest and digest, and help calm the nervous system.
And when you're looking at that, a perfect example is when people see, just like when I started this off, right? When people see massage therapist, what are they thinking? Oh, I need a massage, right? It's the same thing when it's the same thing when I walk into the family parties at Christmas. Oh, the chiropractor's here. I have a crick in my neck that I need. And it's like, no, it's so much more than that. Yes. And one thing I really love, respect, and appreciate about you is that your particular specialty in lymphedema is something that really, really does go underlooked. So what are the underlying consequences of someone who is not properly draining the lymphatic system?
So many, and the symptoms can be something, not sleeping well, foggy, thinking. A lot of people come to me with achy joints or just lack of range of motion, pain, in the body, and just feeling really sluggish. The sluggish lymphatic flow tells you that organs are not actually even working at their fullest potential because they're sluggish to some degree or another. Yeah.
And so those are kind of the symptoms that some people would be able to identify, right? Because I'm sure there's people listening to this podcast right now who are like, I have all those symptoms, but I was told it was from vitamin deficiency, right? Or I was told it was from, stress. Yeah. It's like, so how are people able to kind of differentiate of like, okay, this is a lymphatic issue? And then also on top of that, like, what are some things that people are able to do at home to be able to help some of these remedies, right? There are some remedies that people do at home to help them feel better when it comes to the lymphatic drainage.
Yeah, that's a great question. I love it because not only do I teach massage therapists how to do this specialty through continuing ed, but I teach the community through a workshop called Your Lymphatic System and You Made Simple, what it is, why it's vital, and how you can support it holistically. And I always start with how you respond to stress. It's so important because stress is just a part of life, but how are we responding to it? Because stress, in the moment, obviously it's a good thing, right? We need to be able to get out of danger or, protect ourselves. But over time, it creates inflammation in the body. And then people go to the doctor and they get a disease label. So, number one, how are you responding to stressors? Are you sleeping? What's your hydration look like? The pump of the lymphatic vessels is your breath and the movement of your musculoskeletal system. So are you moving? So there's so many factors that we just don't think about. And a lot of people, I get a lot of texts saying, hey, what can I do? What tea can I drink? So it's all also, what is your food intake and your drink intake? So that's the other key that I talk about. Those things.
The beautiful thing too is, and like, I'm not making this up. you are one of the, because obviously we're very, very close outside of here as well. You are very, very, you're a very resilient person. So for those, who are listening, who are like, oh, like, respond to stress, like, yeah, I hear you. I just want to like let it be known that Mitzi, when it comes to stress, you know how to deal with it, and you deal with it very, very effectively. What are some methods that you utilize to be able to reduce those stress levels? Because, I see it inside of the clinic, right, where people have two different types of nervous system, hyperactive or hypoactive. And what the entire goal is we want to be able to reduce neurological stress and increase the body's resiliency to that stress. And so I always like to ask people, like yourself, like, what are some of those actual things you do to help increase the resiliency to stress and lower the stress load inside of your system?
Yeah. I will say that it is consistency over time, and it's not easy. I think having a good community is really key to getting to where your daily habits and how you respond to stress is necessary. For me personally, having a personal relationship with my Lord Jesus Christ, I also had to learn about boundaries, healthy boundaries with people. I had to learn about emotional intelligence, and I'm talking about stuff years ago that I had to go through.
Yeah.
I went through programs with other people, understanding how trauma affected my body and how sometimes my body responded to stressors, and I didn't understand it up here. But it was because your body can hold on and does hold on, your tissue holds on to stress. And so I think basically it's that understanding root causes, getting in good community, my faith first and foremost, and being willing to say, what do I need to learn? Do I need to learn how to make boundaries? Do I need to learn about emotional intelligence, And it's okay. Those are beautiful things to know that I get to learn about it, and then I get to live on the other side of it. And then when stressors come, your body responds automatically, just like it used to automatically respond to stress in a way. Yeah. Then you automatically respond to stress in a, you start with that breath, right? That breath brings you back. And then you have built some habits of dealing with it in a healthier way.
I've also found, too, gratitude.
Gratitude. Oh, my gosh, yes. Yeah. Gratitude is everything. So great. Yeah. I used to keep a gratitude journal. So every day I'd say what I'm grateful for, because we forget, don't we? We're like, I have so much to be grateful for, know? And so if you start focusing on that, then it becomes your go-to, right? Your MO, let's say.
It's like we're biologically programmed to focus on the negative. We know that this is a lie, right? We know this is a lie that the devil likes to place in our heads of looking at all the things that could go wrong, right? Or looking at all the things that have gone wrong in our life, instead of being able to realize, or for a perfect example is right now, right? We have 3 little girls at home. 3 little girls at home, 4, 2, in like 60 days or something like that. They're not sleeping, right? So instead of waking up, right, this is something that Megan and we've had to transition our mindset to. Instead of waking up like, Lord have mercy, like, why aren't these kids going to bed? Like, I want to sleep. I want to. And we're seeing it as this is a gift from God to be able to wake up and pray, right? 12 a.m., midnight, 2 a.m., 4 a.m., and then the alarm clock goes off. And it's like all of these are opportunities to be able to help strengthen us. Now, I want to make this very clear. It doesn't take away from the reality of like what you're actually experiencing, which is we're tired, right? Or we're processing what it is that we've gone through, or we're processing the fact that we just had a client storm out of here, or whatever it is. Yeah. It's being able to, what is it? It's like, life is 10% of what happens to you and 90% of how you respond to it, or something like that. And I think that shift is very, 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 very important. And have you found that the more stressed an individual is, physical, chemical, or emotional stress, right? The more stress that a person places on themselves, the harder it is to clear out their lymphatic system.
Oh, absolutely. Because, the body is brilliant in how it tries to protect us from harm, right? And so things slow down in your body. One of the things that I see a lot is the gut health. Constipation is huge. And so when a client comes to me and they're filling out this intake form, and they have all these health issues and constipation is on there, they're not really being taught how to or what they can do about it. And it creates this sluggishness. Then your liver and your gallbladder gets sluggish, and your lymphatic system isn't flowing. These are drainage sites in your body, affects your organs, and then it goes all the way up to your mitochondria. That's not healthy when your lymphatic system is not flowing.
So how about talk to me? Okay, talk to me like I'm someone who's never heard of the lymphatic system before. Okay, we hear about the heart, we hear about all these different systems, hear about the nervous system, right? The lymphatic system, I feel, is like that system that kind of goes. People don't really think about it too much unless they're sick, right? And it's like, oh, my lymph nodes are swollen.
Right.
Explain to me what the lymphatic system is. Why is it so important?
Mm-hmm. Yeah, I love to answer that question. And my clients that come in here, it's the first thing I ask, like, what do you know? And a lot of things I know they've picked up on reels and stuff, but still they haven't understood the why. And so what I like to say is, imagine we are made up of 30 plus trillion cells, right? That's us right here. Cells are alive, they take in nutrients, and they get rid of waste. And this cellular waste goes in between the cells, so it's this tissue space. Can you imagine over time you not taking out the trash in your home? Those trash cans just, right? Starts getting stinky and you can't move around in it. So the lymphatic system is like the cleanup system in your body, that sanitation department. And the lymphatic vessels begin in the tissue space. And so there's these capillary beds and they have doors on them. And so when they get pressure on them, the doors open and all this debris comes into your lymphatic vessels, taken in, goes to nodes, gets recycled, and it all goes back to the bloodstream. I hope, was that simple?
Oh, yeah.
Okay, good.
And so essentially the lymphatic system, it's like the cleanup crew.
It is the sanitation department, yeah.
And that sanitation department is responsible for sending clean, and correct me if I'm wrong, they're responsible for sending clean fluid into the bloodstream.
Well, if you mean it brings out all that debris out of the tissue space into the lymphatic vessels, goes to the nodes, it gets cleaned up, goes back to the bloodstream right here under your collarbone. So yes, it's getting recycled, refiltered, and then the last place that fluid gets filters in is in your kidneys, and then we release that waste.
Wow. So if someone's lymphatic system is not working correctly, ideally, so if someone's bloodstream is not, or if someone's lymphatic system is not functioning correctly, this debris is not being cleaned up and could enter into the bloodstream. Is this correct? Like the toxins of it.
Yeah, a certain amount gets in there. But what happens is more of what's happening in the tissue space.
Oh, okay. So we're not talking bloodstream. We're talking tissue space.
Yes, if it's not getting into the lymphatic vessels, then it's building up in the tissue space. And then you've got excess fluid, which might get labeled as edema. Yeah. Some edema I won't touch. Other edema, absolutely. I love to see legs go from swollen to back to normal.
Yeah.
Yeah, it affects a lot.
And so that space is the
Mobility.
extracellular space. Is that correct? From
Yeah, interstitial
interstitial.
fluid, which is in that extracellular space. Yeah,
Got
yeah.
it.
It's really interesting. In the blood, this fluid is called plasma.
Yes.
And then when
Okay.
it leaks out into the tissue space, it's interstitial fluid. And then when it gets into the lymphatic vessels, it's called lymph. It's just the fluid and how is it circulating through the body. And that's one of the important factors of the lymphatic system is that it keeps our blood volume at a homeostatic state. So creates homeostasis in our blood volume.
So, and I don't know if you're, how comfortable you are going into this, but what are some common conditions that someone with chronic lymph issues, right? Chronic lymphatic issues. What are some problems that can arise because of this? Because obviously it's a pretty important system, but full transparency, right? I'm highly skilled in the nervous system. Yes. Highly skilled. I remember learning about the lymphatic system, but not enough for me to honestly even have a conversation about it. So to hear this is actually very interesting to see the link between the two, the neurological system and the lymphatic system. But it seems like the lymphatic system, if those are responsible for clearing out different areas inside of our body, or like that junk, that this is a system that we need to be focused on.
Absolutely. Yeah. All the systems and yes, definitely the lymphatic system, as far as like if we're not breathing and moving, we're getting stagnant in many different ways.
So what are some chronic conditions? Do you see any chronic conditions linked to that?
Absolutely. So a lot of your autoimmune diseases,
right.
I hesitate to say all, but we possibly could, but a lot of your autoimmune diseases have inflammatory issues at their foundation. So many of them. I see a lot of people with so anything itis, that inflammation in the joints, rheumatoid arthritis. So many. Sorry, I was trying to think of what's that called when you get bit by a tick.
Lyme disease.
Lyme disease.
For sure.
So people with Lyme disease respond very well with, lymphatic drainage therapy sessions, and other things, right? That you bring into your lifestyle habits. Swelling, especially in the lower legs, swelling is a big one. I have a client that I just saw who's very tiny everywhere, and I noticed she's really puffy up in her upper arm area, and this is one of our drainage sites under our arm. And so I could actually feel swollen lymphatic nodes. And so after the session, she's like, "Wow, I'm always so puffy here. I actually feel lighter and more range of motion." And so, but yeah, autoimmune disease is a big one. Swelling, and of course, it could back up and create a lot of different disease.
Of course.
Diagnoses. Yeah.
Why do the lymph nodes, like when you get sick, why do they swell up like that?
Because they're working.
Right. So essentially.
Sorry, I was going to say that years ago, 2021, I had COVID for Christmas, and after it, I was doing my own drainage, and I felt behind this big neck muscle here, this huge bump. It was like the tip of my pinky, hard as a rock, and I knew it was a lymph node, and I know it was from being sick, right? The body's doing what it needs to do. It's pulling all that bacteria, viral loads, debris out of your tissue space, sending it to nodes, and they can get a little bit congested. And so I worked on it, and I couldn't get it to drain. And so I started playing around with fascia. My fascia was so tight, it hurt all the way up behind my ear. And so once I released my fascia, superficial fascia can go deep and all over, but that superficial fascia, then I was able to get that fluid through that really full, hard as a rock lymph node to move. And it's amazing work. I love this work. It's gentle and it's powerful.
Yeah, I know we've referred patients back to each other, back and forth to each other. And I know, from what I've heard, it's like it's very, very gentle.
It's gentle and
very,
powerful.
very gentle.
Yes, because we're dealing with the lymphatic vessels that are subcutaneous, right under the skin, with the exception of the abdominal area. Then I go deep into the abdominal area because all of that fluid in that area actually gets all taken up in ducts, and then that forms one main duct, and it perforates through the diaphragm, comes up under your sternum, and that's how it goes back to the bloodstream.
Yeah.
But I will say this, and I tell this to all of my clients, because I've had some clients come in here and they're saying, I'm a little nervous because I've heard it hurts, or I've had it done before and it hurts. And to that I reply, I'm sorry that you experienced that. Because the truth is, it is so powerful and gentle, and it should never hurt. It should never hurt. Yeah.
So why did you decide to pursue a specialty with the lymphatic system, with lymphedema, right? As a massage therapist?
Yeah. So I got my massage license in 2002, and we learned about all the systems of the body. But the lymphatic system just intrigued me because you can't fix it with medication or surgery.
Right.
It requires this touch. And I believe that there's not enough healthy touch in our society. And I just love people. And so in 2006, I went to Boca Raton, and I stayed there for 2 weeks, and I got my 135-hour training and certification as a lymphedema therapist. Came back, brought it to the community of oncology, mainly, a lot of women who are suffering from breast cancer.
Yeah.
But I work on a lot of different types of cancers with people. So that's why I was so intrigued that you can't fix it any other way but understanding how to support it, how it moves, and then how to deal with it manually. So MLD stands for manual lymphatic drainage.
Okay.
So it's a manual touch to drain the body through lymphatic vessels.
Wow. Yeah, it's pretty fascinating.
I know.
To say the least. Very, very fascinating. Because what we find with a lot of this stuff, it's a frustration of mine. Not to get on a soapbox, but it's a frustration of mine where it's like all these different conditions that are caused by all these different things, right? Physical stress, chemical stress, emotional stress, all these different things that are caused by it are creating these conditions called idiopathic. Autoimmune, right, is a perfect example of idiopathic condition. Migraines are an example of an idiopathic condition. Fibromyalgia, idiopathic condition, where it's like we know that there's a problem, but we don't know where it's coming from.
Yeah.
But we're going to prescribe or do different things to try to mask the symptoms when the reality is there's these systems that are correlated with each other getting to the root cause of it. And it seems like the lymphatic system is a pretty important system to get to the root cause of it, right? Nervous system, what I see, very important to get to the root cause of it. What are the correlations between the nervous system and the lymphatic system? How do those two coordinate with each other?
Well, I will tell you how fascinated I am with the glymphatic system in the brain, right? I mean, talk about neurons and all that stuff going. I mean, that's your specialty, right? Right there.
Right.
So the glymphatic system is the lymphatic system of the brain. Interesting that the lymphatic system of the body works while we're awake and we have to breathe and move. The brain drains, we have to be asleep. So understanding the importance of sleep, for years we've understood that our brain heals when we sleep, right?
Right, for sure.
Now we know why. Back in 2015, scientists are discovering the depth of the drainage in the brain, and it's so much different than in the body. So we must be able to get sleep, and they are understanding that, and it's named the glymphatic system, more likely because of the glial cells that are important for all that drainage there. And that they're finding that it's going to have a profound effect on Alzheimer's. Anything where the brain is getting sticky and not cleansing and not cleaning out. So I hope I answered that.
Oh yeah.
For you.
Yeah. That
But,
there's a different reality, right? The different reality is that what we see is one thing, right? We see Mitzi, we see myself over here, right? Like we see us, but there's a deep internal structure, right? There's these deep internal systems that can get sticky, that need to get moved, that need to get what I like to say buffed out, right? All these things inside of our body need to be able to take a very particular, very specific route of administration to be able to clear these things. And that there's providers, right? There's providers like you, there's providers like me that are actually able to correct the issues, right? And not just within our respective fields inside of the clinic or inside of your practice, but actually inside of, but also providing value of things to be able to do at home. Last question I have for you is this. For someone who's watching this, they don't know where to start. They don't know what to do. They don't realize, are they having a lymphatic problem? What is the most important key indicator? Just one. The most important key indicator that they are having a lymphatic issue.
Boy, that's hard, Dr. Cam.
I know.
Just one. Feeling puffy.
Swollen.
I feel so puffy or swollen, but a lot of people use the word puffy.
Yep. Okay.
Yeah.
And the reality is, if they're feeling that way, that could be prolonged inflammation, right? Absolutely. Inflammation is a very hot topic right now.
Yeah.
So if they're feeling inflamed or puffy, that's a very key indicator that there's an issue going on that could be coming from the lymphatic system.
From a sluggish lymphatic system, yes. Yeah. Yeah. And I will tell you, certain medications are a big issue with inflammation around the body. Yeah.
Well, it's the chemical stress, right? Their body has to filter these chemical stressors of medication that are coming into the system.
Yeah.
That's the same thing as going through something emotional, or the same thing as going through something physical, like a very tough workout. These chemical stress, like your body has to filter that out. And if it has a tough time, boom, it can get blocked.
Absolutely. Yeah.
So, Mitzi, you are, when I tell you it's a joy, you know, obviously I'm not from Michigan, or I'm from Michigan originally, moved to Arkansas. You were a joy, not just when I first met you, but also throughout the way that our relationship has continued to evolve. What you bring to the table is something top tier. And I really, my prayer is this, that people that are listening to this understand that this is not just any guest on this podcast, that this is someone who teaches the lymphatic work, right? This is someone who knows and understands the ins and outs of it. And that the wisdom that you just gave to these people is something that's very, very, I don't take it for granted. I've learned a lot from this. And I know that those who are listening learned a lot from this. Someone out there who's sick and suffering, they need to hear one word of encouragement. What is it?
Hope.
Come on.
There's hope.
Come on.
Yeah.
That's what we like to say. Get hope, get well, and live life.
That's right. That's right.
So how can people find you, Mitzi?
Oh, goodness. My website is a good place to start. Mitzi at mitziannlove.com.
Okay. Right on. And then go there. People are able to check you out. It's been an absolute privilege and a pleasure to be able to have you on. I look forward to more to come. So God bless you, Mitzi. Thank you so much for coming on.
God bless you. And I appreciate all that you do, Dr. Cam. You are a gem.
Take care, my friend.
Thank you. Bye.